You've verbalized to the teacher, checking the name of the patient, the date of birth, and also the kind of a procedure I'm going to do. So it will say insert Foley stop, all right? Simple, all right? So, because you cannot bring around you cannot carry the doctor's orders anywhere else, it has to be left in the chart. Either you memorize that, or the name and date of birth, or write it in a piece of paper or a notebook. So you gather, you wash your hands, you gather your supplies. Okay. You have the kit, the tape, all right, the securing device, the sterile gloves, and also we need one extra. Clean gloves. It can be a box of gloves.
I don't like your back, Max. So back off.
Well, you're in my way. Move a little.
No, that one, the box.
The camera can move. You see, look, this is technology. Look. You see?
Okay, so you move with the camera.
Extra glove we use on.
You're so convenient.
You need
when you touch everything with the.
All right.
The Foley.
Thank you. Thank you, Miss Nurse.
Thank you, Miss Nurse student.
All right. So you need to gather the right supplies. It will all be on the table, and make sure you gather all the things that you need. So you go into the patient's room, introduce yourself. Hi, hello, I'm so-and-so from LaGuardia Community College. What is your name? What is your date of birth? Check the ID band, and you explain to the patient what you're going to do. I'm going to insert Foley on you, okay? If the teacher asks you things like, what do you have to check? What else do you have to check? You have to check if the patient has pain, because if she does, you need to medicate the patient first.
Okay.
And you wait 30 minutes before you start the procedure. So everything is okay with the patient, and now we're gonna move on. You provide privacy, increase the bed height. Make sure that you increase the bed height. These beds, the new beds, they don't go up too high. This is the highest, I think. But the other beds in the other room, they go really high, like over here. Because they want to see good body mechanics. They don't want you bending too low. All right. So after that, you're going to go and make sure that everything is in the right place. So this sterile gloves has to be over here. And this one is here. All right, so you're going to prepare 2 short tapes. If you're going to use the tape, a tape for to secure the catheter, you need to prepare it right now. But we have the securing device, but I'm sorry to tell you that you can only use this one. It's time for the test, because we only have a few of this, just enough for the test.
Okay.
Okay. So for practice, you can use this securing device, But this is very easy. I'm gonna show you how to use this. Okay. So you prepare your tapes first, and then you're gonna make your garbage. Garbage bag is this one, the one that is
Comes packaged in.
Comes
packaged in.
Yep, the kid's bag. Okay, make sure you secure this, because you don't want that falling on the ground. And also, when you open the bag, make sure that you don't rip this like this. It has to be connected. You have to open this paper, not removing it from this end, all right? Because you cannot open this really wide if you're not using the paper like this. Since this is already used, I'm gonna have to secure this end like this. All right. So make sure it's open. All right. So, like that. All right, you're gonna wear your clean gloves, okay? And you're gonna go over here and talk to the patient. Miss Mayor, are you okay? All right. I'm gonna open your gown and the linen. Okay. You verbalize to the teacher. You're gonna check for bladder distension. So you go like this. All right? And don't go like this. This is wrong. You go like this. You feel it with your palm. Okay. So normally we don't feel the bladder, okay? But if it's if the patient is retaining or distended, if the patient's bladder is distended, that means she's retaining urine, right, inside. And you're gonna feel it looks like it feels like a balloon or a ball. And the more urine inside, the harder it is, and the more you can feel the form, right? And what is the reason why we're palpating? Because you just want to check if she's retaining urine inside the bladder. And you are not checking because you need to check to check if she needs the catheter or not. Distended or not, you need to insert the catheter because there's an order, all right? So next, you're gonna go over here. I'm gonna check if I need to do perineal care. I did perineal care, you know, washing with water and warm water and soap. Okay, I did it this early morning. Okay, she's okay. And also, they might ask you also, where's the bladder? Okay, so it's above the
Pubis
pubis
symphysis.
symphysis, okay, or pubis, yeah, symphysis pubis.
Symphysis pubis, yeah.
Distended bladder, what are we going to do?
Huh?
You still have to use the catheter.
Oh yeah, you just take note, all right?
If it's not distended, anyway we do it.
It's
Yeah.
because they're in order, yeah.
Yeah, you just need to remember, all right?
Okay.
And you have to take note. You have
Document
to,
it.
Yeah, document it. Very good, sir. All right. So you close that. You're gonna go and fan fold this. All right. And then you're gonna go and.
Is that when you do assessment of the vagina to see if there's any lesions or things like that? No?
Yeah. Yeah, you can do that also because you're there already.
Okay.
You know, you're doing assessment already right now. Okay, you're gonna position the legs, okay? This is lithotomy. You put up the leg away from you first because if you do this first, you're gonna go over it and it's not very, not convenient, okay? So you go like that and then you put the cat secure, yeah. Or some people, they call this butterfly, but we just call this the securing device. All right? Not too close. This is too close, all right? It should be a little bit, you have to put a little bit of an inch or two over here.
Okay.
This is too close. I don't know who put this over here. But, let me put this.
It's getting this stuck to your gloves.
Yeah, that's too. This is too close. Actually, it's gonna be too inconvenient and also very uncomfortable for the patient. Again, it has to be in the right place. Don't put it over here. That's the no. And there. Okay, I missed. Sorry about that one.
Sure.
Anyway, you put it over here. All right. Very easy to peel. Very easy to put. Okay, so this is how it looks like. Okay, make sure you take this. All right. Then you're gonna remove your.
So we
gloves.
gather ourselves the supplies. It's not going to be ready for us. We're just going to
Of
pick it up.
course, you have to pick it up. Okay, all the supplies.
Mylene, if it's already there, we don't have to open it, right? We just,
Yeah.
You don't have to open it.
Maybe
but
you just
still gather
verbalize
it.
it.
Yeah, you
just
just
gather
gather.
for-
Yeah, you gather. Yeah.
Okay.
So
So we
that
need
the
to.
teacher knows that you have to gather that one. It's a part of the.
We need the
supplies.
container, the security device,
Five
scotch
things.
tape,
Five.
and
That's the
Scar-
scotch
no,
tape,
yeah,
the
but,
medical tape. Yeah.
medical tape, and then you need gloves and you need sterile
Sterile
gloves.
gloves.
Clean gloves and sterile gloves.
Okay.
All right, so all gloves are removed properly because if you have blood over here or mucus or whatever, body secretions, you don't want to contaminate your skin. If you go like this, you're gonna touch your skin. So you need to pinch it over here, pull it, all right? Do not touch the outer part. And then you go like this, you bunch it in there, and then you go and use 2 fingers, you go like this. All gloves, soiled gloves are removed like that. So you throw that, you wash your hands, okay? So twice you need to wash your hands, okay? Now you're gonna go over here. Let me see, because this one I think is, okay. This flap has to be going away from you. I just checked it, all right? I'm sorry. I'm not supposed to go like this, all right? You're not supposed to do that. But the first flap has to be going away from you.
Okay.
So don't go like this. You pinch over here.
So you don't go over it and
Yep.
contaminate it.
It's a sterile field. Cannot go over the sterile field. And then you go like this. All right. From there, you're gonna walk sideways to your, and yeah, sterile gloves. Do not, you see that? Something is falling. That's contaminated already. So from there, you're gonna go sideways to your sterile gloves. And verbalize to the teacher, I'm checking the sterile field, all right?
Okay.
The sterile field and the patient, all right? If the side rails is really, really long, you have to put that down also. Okay, so putting the sterile gloves is part of the test. Put it properly.
Do we need to know our sizes? I don't know if it's going to be
Of
different.
course, you need to know your sizes.
Crap.
Yeah, but I think yours is probably 8 or 8.5.
I tried 8.5 in the room and I couldn't put it on.
Really?
My hands are too wide.
9.
All right, we'll go with 9.
Oh, 9. Okay. This actually, you need to make sure that the flap is not going to fold back, right? Because technically it's contaminated if it folds back.
So we do the sides.
Okay, so remember I told you before that if you contaminated a sterile thing or sterile part, you need to verbalize that I'm gonna throw it away and get a new one. You just verbalize that, you know, I'm sure they will tell you, just go on. You know. As long as you mention that or you verbalize that.
As long as you mention your mistake, you're
Yeah,
okay.
because you need, you cannot assume that they did not see you. All right.